looked at him and I thought, you can't die on my birthday. I won't let you.
We knew that night that he was a retired fireman.
It was about 11:30 p.m. We got called for a possible cardiac arrest.
4 minutes of CPR, it's tiring, it's exhausting.
Even if they have one save for their entire career, here's a man walking through their fire station 50 some odd days later.
He put in so much time and he put a ton of good into the world. It was nice for him to get some back.
Responding during critical times and answering every call. Your job as an EMS professional is never done. We at Medline want to say thank you for your dedication and your service. We have seen your strength and resiliency, and we want to thank you for allowing us to advocate for the EMS family. As your partner in medical manufacturing and distribution, we stand by your side every day to remove the obstacles in your way. With our transparency and wide range of distribution centers across the country, we are here to make sure you have all the support you need to care for your patients every day. So thank you, today and always, for all the work that you do. Like you are always there for us, Medline is here for you.
Looked at him and I thought, you can't die on my birthday. I won't let you.
We knew that night that he was a retired fireman.
It was about 11:30 p.m. We got called for a possible cardiac arrest.
4 minutes of CPR, it's tiring, it's exhausting.
Even if they have one save for their entire career, here's a man walking through their fire station 50 some odd days later.
He put in so much time and he put a ton of good into the world. It was nice for him to get some back.
Responding during critical times and answering every call. Your job as an EMS professional is never done. We at Medline want to say thank you for your dedication and your service. We have seen your strength and resiliency, and we want to thank you for allowing us to advocate for the EMS family. As your partner in medical manufacturing and distribution, we stand by your side every day to remove the obstacles in your way. With our transparency and wide range of distribution centers across the country, we are here to make sure you have all the support you need to care for your patients every day. So thank you, today and always, for all the work that you do. Like you are always there for us, Medline is here for you.
Looked at him and I thought, you can't die on my birthday. I won't let you.
We knew that night that he was a retired fireman.
It was about 11:30 p.m. We got called for a possible cardiac arrest.
4 minutes of CPR, it's tiring, it's exhausting.
Even if they have one save for their entire career, here's a man walking through their fire station 50 some odd days later.
He put in so much time, and he put a ton of good into the world. It was nice for him to get some back.
Responding during critical times and answering every call. Your job as an EMS professional is never done. We at Medline want to say thank you for your dedication and your service. We have seen your strength and resiliency, and we want to thank you for allowing us to advocate for the EMS family. As your partner in medical manufacturing and distribution, we stand by your side every day to remove the obstacles in your way. With our transparency and wide range of distribution centers across the country, we are here to make sure you have all the support you need to care for your patients every day. So thank you, today and always, for all the work that you do. Like you are always there for us, Medline is here for you.
Bruce, we're ready.
All right. Great. It's my great pleasure to welcome you to the 2022 EMS Day on the Hill briefing. Thank you so much for making this special effort to be here to represent the EMS profession. Since 2010, EMS Day on the Hill has been a very visible display of our professional unity on behalf of our communities and on behalf of our patients. I'm very pleased to report that we have 310 registrants for EMS Day on the Hill from 49 states, the District of Columbia, Puerto Rico, and it's the largest number of registrants that we've had in the history of the event. Through our years of advocacy work, we have clearly learned that the most productive way to advance EMS is through a unified message to our legislative leaders. In 2021, EMS Day on the Hill was held virtually due to the public health emergency. This year, due to heightened security concerns in our nation's capital, we are again doing EMS Day on the Hill virtually. But whether we do our Hill visits in person or virtually, educating federal legislators on key challenges and the needs is critical. Through the pandemic, our workforce has time and time again risen to the challenge on every level. We've demonstrated our ability to adapt and to respond to longer patient handoff times at hospitals, longer work days due to the workforce shortage, and limited and more costly supplies due to supply chain bottlenecks. In addition to providing our traditional 911 services, we have also provided COVID testing, vaccinations, and monoclonal antibodies. Many in our workforce have been filling in at hospitals, substituting for school nurses, and our national organizations have rapidly adapted as well as to address the immediate needs of our members. We have risen to the challenge at every turn. It's no surprise that this year's theme for EMS Week, which is May 21st or May 15th through the 21st, is just that, EMS, rising to the challenge. Each of you have risen to the challenge by participating in EMS Day on the Hill, so that EMS in your communities and your states is represented fairly. I hope that you all conclude your upcoming meetings by reminding your senators, representatives, and their staffers of EMS Week and invite them to honor our nation's EMS professionals in any way they can, to post on social media or to do some kind of public recognition. You can also invite them to tour your EMS agency or invite them for a ride along. The more they understand about EMS, the more likely they're going to be able to help us address our challenges and the needs of our patients. NEMT and several national organizations have joined in unison to support our patients and our profession at the national level. Since last year's Hill Day, we have sent 18 letters to congressional leaders, mostly joint letters with other EMS organizations requesting increases in provider relief, EMS-specific grants, assistance for workforce development, the elimination of sequestration cuts, and other common challenges. We've conducted grassroots advocacy campaigns in which all EMS professionals could participate. That resulted in over 11,000 emails going to members of Congress. We adopted joint positions on managing agitated patients, protecting the EMS workforce, and the use of lights and sirens. I'm proud of our work together and the collaboration that we have done on so many things and how impactful it's been over the last few years. Thank you for partnering through our EMS challenges together. And as you know, funding is probably the single greatest challenge facing EMS. And funding for EMS Day on the Hill is a yearly challenge as well. NEMT works hard to keep the registration fee very low, and we recognize the investment that you make to participate. NEMT seeks assistance from EMS supporters to help offset the cost of holding this event. We're deeply grateful to the companies that have sponsored this year's Hill Day. In these organizations, they've helped out with EMS Day on the Hill financially, and it helps to make it possible. I'm going to start by recognizing our sponsors. The first one is our capital sponsor, which is Stryker. Our pre-Hill briefing sponsors are the American College of Emergency Physicians, Demers, Braun, Crestline, and Medics, Medline Industries, and the Public Safety Consulting Group. Our advocate sponsors, Boundtree, the Coalition Against Big Trucks, FirstNet, built out by AT&T, General Devices, Logis, McKesson, Pulsera, and the Rev Group. Our award and event sponsors, Demers, Braun, Crestline, and Medics. Stryker is also included in this group, along with our friends of the EMS Day on the Hill, Page, Wolfberg, and Worth. I want to thank all of our sponsors, our generous sponsors, for making EMS Day on the Hill possible. Before we review this year's congressional request, I want to share with you the process for which we select bills and issues we discuss each year on EMS Day on the Hill. It's a pretty simple process. We identify the bills and the issues that are most critical to our profession and our industry, and that are supported by the greatest number of EMS stakeholders and stakeholder groups. Although not all EMS stakeholder groups agree on every issue, we've learned that EMS, to be effective on the Hill, our requests have to be aligned and they have to be presented with a unified voice. I want to give special thanks this year to our colleagues at the American Ambulance Association, the International Association of Firefighters, the International Association of Fire Chiefs, for their continued efforts to work collaboratively with NAEMT on many legislative issues. We truly value these relationships and appreciate how important it is for EMS to work together. We'll now review each of our Hill Day requests to Congress. And after all the requests have been presented, there will be an opportunity for questions and answers. First, it's my pleasure to introduce Sean Baird, the president of the American Ambulance Association, who will provide an update on the 5-year authorization for the Medicare extenders.
Thank you, Bruce. I really appreciate the opportunity to be here with all of you this afternoon as we get ready for your Hill visits. As Bruce said, what we're asking for is a 5-year extension of Medicare extenders. And these extenders are extra payments for Medicare, which makes up, anywhere from 60+% of the calls that folks run and get reimbursed for. And in urban areas, the amount is an extra 2%, rural 3%, and super rural 22.6% add-on payments. And these expire at the end of the calendar year. It's absolutely critical that we get another 5-year renewal. There's a crunch of events happening in EMS this year with the different cuts, as Bruce talked about sequestration. There's another cut of 4% at the end of the year. We have cost data collection. We have a MedPAC study. And I know that's a whole lot of acronyms and a whole big mouthful. But what I want you to take home from that is that there's kind of a cliff at the end of this year. And it's not just these add-ons. It's a whole series of events that would have been spread out as several years, but because of the COVID public health emergency and things getting delayed or pushed out, they all line up in 1 year. So it is absolutely imperative that we get these extensions. And we have 2 bills that address this in the Senate. It's Senate 2037, and in the House, it is HR 2454. Both of these have great bipartisan sponsors from leaders on the committees of jurisdiction, both Democrat and Republican. We've always had great support in Congress before, but it often comes down to the politics of the year and making sure that things, it's not that they don't want to help EMS, it's that the way Congress works or doesn't work, depending on how things are going politically, it can be tough to make sure that these issues that are really important to us, but maybe don't hit the national news radar screen, that we get included in the things that do get through at the end of the year. So I think the best way to ask for that is to do what you do best, talk about the great work that you do every day, how important it is to your community, and then ask them to sign on as a co-sponsor to the appropriate one of those two bills. So thanks, Bruce.
Thank you, Sean. Can you repeat those, the bill numbers again, the House bill and the Senate bill for the Medicare extenders?
Yes, on the Senate side, it's Senate Bill 2037, sponsored by Senator Cortez Masto, Senator Leahy, Stabenow, Sanders, and then on the Republican side, it's Collins, Bozeman, Cassidy. That's Senate Bill 2037. And on the House side, it's HR 2454, Representative Sewell and Welch, Blumenauer, a number of others. On the Democrat side and on the Republican side, we have Mark Wayne Mullins, Representative Nunes, Stefanik, and others. Both of them are known as the Protecting Access to Ground Medical Services Act.
Okay, great. Thank you, Sean. And I think it's important for those that are lobbying these bills that, you know, the Medicare extenders barely cover inflation.
Yeah. And they've been around for probably, I think it's 19 years that Congress has done these add-on extenders, always talking about making them permanent and understanding that we need even more than these extenders. This is just a Band-Aid in our lingo, but they know it's important. They just need to hear it from you that it's what's keeping it together.
All right, great. Again, thank you, Sean, for presenting that topic. And now I'm going to move on to introduce Chief Gary Ludwig, the past president of the International Association of Fire Chiefs. He'll provide an update on the fiscal year 2023 Siren Act Appropriation.
Thanks, Bruce. I appreciate it. Appreciate all you do. Good afternoon, everybody. And for those of you on the West Coast, good morning. Just want to share some information with you about the Siren Act. This is, we're asking for you when you meet with your legislators to ask them to please support the FY 2023 funding for the Siren Act, and that's the acronym, but the name of it is the Supporting and Improving Rural EMS Needs Law. The Supporting and Improving Rural EMS Needs Law, and that, again, the acronym being Siren. So the Siren Act was actually passed a few years ago by both houses of Congress as part of the Agricultural Improvement Act of 2018, and it was signed into law on December 20th of 2018. So we've had 3 years of funding of this so far. The first year, there was $5 million that was available, second year, $5 million, and last year there was $7.5 million that were available to rural EMS agencies. So I don't have to tell you how difficult it is to manage and fund a rural EMS agency. The call volume is just not there in order to sustain the operation. So you have to look for additional revenue sources. This law, this bill gives you the opportunity to apply for grants and get some additional funding for your rural EMS agency. It basically creates a grant program for public and nonprofit EMS agencies and fire departments in rural areas to support not only the operation, but also the recruitment, the retention, education, and any equipment purchases that you may need to do. Rural and fire departments often lack the resources to pay for even some of the most basic operational needs, as many of you know. The pandemic really, truly has exacerbated this problem and these challenges. It's created many rural problems or crises for many rural areas. And again, hopefully this funding will help you alleviate some of those challenges you may have. So what we're asking is that you please talk to your lawmakers in the Senate and the House to share, they should share their support with the Senate and House Appropriations Committees to reauthorize and fund the Siren Act at $20 million. Now, again, I just gave you some figures of $5 million the 2 previous years and $7.5 million this last year. You know, that's good, but we can do better. We're asking you to have them fund this at $20 million for FY 2023. These are much needed grants, and these resources are needed for already strained EMS agencies who are working to provide life-saving medical care to the patients in their communities. So how this is done is through grants, through the Substance Abuse and Mental Health Services Administration. They will administer these rural EMS equipment and training assistance grants. And through that, what has happened in the past is what we have seen is that, as an example, in FY 20 and 21, this agency awarded these grants ranging from anywhere from $92,000 up to $200,000 to approximately 27 EMS agencies in multiple states for recruitment and training purposes. In December 2021, the agency announced plans to award another 27 rural EMS applicants for 2022. So this grant is supported by a multitude of national EMS and fire organizations. And with that said, Bruce, I'll turn it back to you, and I'll be available later if anybody has any questions. But please ask your lawmakers to share their support with the Senate and House Appropriations Committees for this Siren Act at, again, $20 million. Thank you.
Thank you, Gary. And I can just vouch for this from personal experience that my agency got a Siren Act grant last year. It was one of the $200,000 recipients to train EMTs and do recruitment. It's made a huge difference. This is a very valuable program, and hopefully we can get it funded so it can reach out and touch a few more people in the rural EMS environments. So now please join me in welcoming Evan Davis, the Deputy Director of Government Affairs at the International Association of Firefighters, to provide an overview of the Ems Counts Act.
Great. Thank you so much, and good afternoon to everybody. Great to have you all joining us. We're lucky in this country. EMS looks very different in every community. In many ways, that's a blessing that's allowed us to develop EMS systems that are custom fit to address the needs of each community. We also have a lot of challenges as a result of that diversity of explaining who we are as an industry and how we operate. Even simple questions like how many EMS providers serve in the US has been a really difficult one for us to answer. The Bureau of Labor Statistics currently tries to develop a count of how many people are employed in various professions across the US. EMS is no different. The Bureau of Labor Statistics tries to get a count of the number of EMS practitioners that we have. But unfortunately, they use a methodology that really fails to capture an accurate number of how many EMS providers we are and how large of an industry we are. Up until recently, these surveys from the BLS didn't even differentiate between basic life support and advanced life support providers. Initially, respondents to these surveys were only able to select whether they were an EMT. There was no opportunity to reflect their actual certification level, whether it was at the advanced EMT level, the paramedic level, or elsewhere. The Bureau of Labor Statistics, through these surveys, also didn't even allow firefighters to indicate whether or not they were an EMS provider. Similar to the certification level mentioned a few moments ago, firefighters were forced to select if they were just a firefighter or an EMT. Collectively, our groups worked throughout the mid-2010s to try to address this issue, and we were initially successful in terms of getting a little bit more detail for the EMS provider certification level, and BLS accepted our recommendations to have respondents say if they're licensed at the paramedic level or the EMT basic level. But our recommendations to gather information on the number of cross-trained firefighter EMS personnel fell on deaf ears of the BLS. We made a few runs at this to try to get BLS to tackle the issue administratively. Unfortunately, they really rejected that push multiple times. Having this data really is important to us as an industry and how we grow and how we access those needs and resources to address our needs. The federal government relies on headcounts for employees when developing all sorts of funding priorities and programs. And EMS is no different. Programs like the Siren program that Chief Ludwig mentioned a few moments ago, the FEMA Urban Search and Rescue Task Forces, and all mutual aid agreements could look very different depending on how many EMS personnel we have. And frankly, the fact that the federal government really recognizes only a small fraction of EMS providers is one of the big challenges to growing these programs. One of the most recent places we ran into this challenge was during the early days of the COVID pandemic when the vaccines first became available. The federal government at the time was trying to identify how many EMS personnel served in the country, and thus how many vaccines would be needed to cover all the EMS practitioners. What came out was a little bit startling. HHS claimed that only around 500,000 vaccines would be needed. Since it was a 2-dose vaccine, that kind of let us realize that HHS thought there were only about 250,000 EMS providers in the country. Now, you, me, and everyone else on this webinar knows this is definitely not correct, and the true number is a lot higher, but we weren't able to say what exactly that number was. Enter the Ems Counts Act, and this is a really important piece of legislation, and it directs the Bureau of Labor Statistics to improve the accuracy of their census and more better identify who provides EMS care in this country. The bill would direct the Bureau of Labor Statistics to address that issue of how they count dual role firefighter EMS personnel. Under the bill, the Bureau of Labor Statistics would create an option for dual role firefighters to identify if they're a firefighter EMT, firefighter paramedic, or whatever that level may be. We're really excited at the IAFF to be partnering with NAEMT and other national fire and EMS organizations to encourage Congress to really direct BLS to address this issue. When you're talking with your members of Congress in the coming days, it's really important to emphasize with them just how critical it is that we have an accurate idea of how many EMS practitioners serve in the United States. When you talk with them, they'll probably want to know how we got to this point. Members of Congress often like to know, did we try a regulatory solution before jumping to legislation? And you can let them know we did. We tried to work with the Bureau of Labor Statistics, didn't really get to what we as an industry need. And so now we're coming to Congress. And that's why we need Congress to step in and make this change. It's really impossible for us as an industry to have meaningful conversations about federal funding, pandemic response, and workforce initiatives without knowing what our industry looks like and how many of us there are. The Ems Counts Act is a really, really important way to drive these conversations and ensure EMS agencies have all the resources that they need to continue serving their communities. So make sure in the coming days when you talk with your members of Congress, clearly ask them to co-sponsor the Ems Counts Act and make sure that our agencies and all of EMS has what we need to keep serving our communities. And the bill numbers for those two bills in the House, the Ems Counts Act is HR 2354. And over on the Senate side, it's S like Senate 2971. Our lead sponsors in the House are Congresswoman Susan Wild and Congressman Fred Keller from Pennsylvania. Over on the Senate side, the charge is really being led by Senator Bob Casey from Pennsylvania and Senator Susan Collins from Maine. All four of those folks are great friends to the fire and EMS industry, and we're appreciated getting to lean on them for this effort. So thank you all again for your advocacy.
Thank you, Evan. And now I'll move to Matt Zavatsky, the immediate past president of NAEMT, and he'll provide an overview on the EMS workforce development issues.
It's a big issue. Thank you very much, Bruce. And I also want to really congratulate the coalition of folks that you are all seeing here together on the virtual stage, if you will. But it's super nice to have the IAFF, the IFC, the AAA, NAEMT all together with us today. For those of you that may not know, this coalition meets every other Friday at noon. Come hell or high water, sometimes it's high water, but they really do a good job of getting together. And we really work through a lot of issues together that have been terrific for the EMS and the fire profession, regardless of your provider type. So as you talk to folks from the different organizations and the different facets of EMS, just know that the volunteer leaders, the staff, the government affairs officials from these associations have a closer relationship than we probably have ever had before. And we're so grateful for that. And I just wanted to not let that moment go without some recognition of how important it is to all of our organizations. Everyone that's going to be attending EMS on the Hill, and certainly the industry, knows that workforce shortage is probably our #1 issue. A lot of it goes to what Sean talked about with the Medicare extenders and the funding and the economic issues. But we don't have specific language, but there's a number of vehicles that are already in play that EMS should be a part of. And we'll have this again as part of your briefing packets that you get electronically before your meetings with members of Congress. But overall, we just want to support and ask you to support or have them support legislative initiatives that help communities address this worker shortage. Just in 2001, there was a sweeping survey done by the American Ambulance Association that identified a 20 to 30% turnover rate in EMS personnel annually. So you can imagine how difficult it is to keep providing those services. And some data recently mined from the National Registry of EMTs shows that between 2019 and 2020, the number of newly certified EMS practitioners dropped 21%. So if they're leaving and we're not backfilling them, here's where lies the problem. So we'll have a little bit of that data for you in your handout. The first major initiative, the Siren Act, Gary did a phenomenal job going over that, so we won't do it here, but that is a significant workforce development issue. And just keep asking people to fund the Siren Act, as Gary did such a great job illustrating. Second is to include EMS eligibility for existing federal grant programs to support apprenticeship programs. Apprenticeship programs are a great way to bring people into the profession and to help offset the cost of bringing those folks into the profession. And it doesn't matter whether you're a fire-based EMS agency, a private, public, third service, governmental. Apprenticeship programs can be used very effectively to bring people into the program, and we just want EMS to be included in the eligibility for existing grants that are available for workforce apprenticeships. EMS should be part of that. It's one of the biggest challenges that we have in our profession. And then finally, ensure EMS access to other federal grants to develop the workforce. The American Rescue Plan, ARPA, that you often hear about, allocated $1.5 billion with a B to expand the healthcare workforce. But did you know that EMS is not eligible for that funding and for those grants? So we want to educate the members of Congress and everyone that we can that we should be. We are healthcare providers, and being able to have access to that funding could be a lifesaver, literally and figuratively, and certainly an agency savior. And that's all through HHS. So it's a very logical, synergistic partnership between the EMS industry and HHS and Congress to use some of that ARPA funding to help develop the EMS workforce. Lastly, I want to leave you this information. Many of you may have heard that last week, Senator Sanders proposed legislation called the EMS Staffing and Support Act, or Senate 3910. That bill is somewhat problematic. And to be quite frank, the coalition that we just referred to at the beginning of this part are not necessarily very supportive of that bill. Although we are excited that it's getting additional attention and conversations at the Capitol level, we are very concerned that the bill leaves out a lot of the agencies, fire agencies, other types of EMS agencies, and it's very narrowly defined. And we're going to try and work together to change that language. But as the bill stands today, it is not something that we are going to support. So if you are asked during your Hill visits by one of the staffers or by one of the members, hey, what about Sanders' bill? Really, your best response, and we'll give this to you again in writing, is just to let them know that several national EMS associations are still evaluating the bill and will be contracting the bill's sponsor to discuss. Because as the bill is proposed right now, none of us think it's something we can support. So that's a little briefing on the workforce issue. Again, you're going to get a lot of this information electronically, and your state coordinators will help with that as well. And Bruce, thank you very much. Back to you, sir.
All right. Thank you, Matt, for the overview on the workforce issues. I think it's also important to note that NAMT, along with some of our partners, have requested Congress to have a congressional hearing on the workforce issues. There are so many different facets that are related to the shortage of people coming into this profession, and that it probably needs a congressional hearing and a deep dive into it, as we know that there are a lot of different factors. So now we'll take a few questions about the request from our attendees. Chelsea Hickman from our partners at Winning Strategies in Washington will assist me with the questions. Do we have any questions already put up, Chelsea?
Yeah, and just a reminder to folks, if you want to ask a question, please just type it into the Q&A box. One of the questions was, are we going to get information disseminated to us in writing? Answer is yes. You should have received an email from NAEMT with talking points and white papers, but I will also enter in the chat where you can get all of that information online. Another question was, what is do we expect to have any pushback on the extensions of the Medicare extenders for the ground ambulance? Because there was money in the American Rescue Plan, there was money in the CARES Act. Bruce, do you want to answer that? Or
Yeah,
Sean, I know you addressed it as well.
Yeah, and I know that, you know, some of the ARPA money and some of the other monies that came down to the counties, much of that did not find its way into the hands of EMS providers or to EMS agencies. And while there was some bumps that occurred with some relief money for supplies, and there may have been some additional Medicare funds that folks got, I can tell you personally, we put in a request for bonus money, which was eligible in some of the relief money for our EMS providers in our county. And we were told by our county commissioners who received that $11 million that they had a hard time differentiating us from grocery store workers and the folks at Public Works. So they didn't feel it was fair that they could distribute that money. So I think there's more to be had by that. I think there's if you get challenged with that issue, I think you can say that there's a lot of that money that did not find its way from the government agencies it was distributed to into the operational aspects of EMS.
Thanks. Sean, do you want to add anything to that?
I think just that the add-ons are really all about the continued sustainable funding stream, as opposed to some of the one-time influx of funds that were related more to the pandemic to try to cover specific pandemic-related costs. And then the add-ons are really all about building a sustainable system for now and the future.
Thanks, Sean. Another question that's come up with is, where's the best place to see which states and agencies receive Siren Act grants? We can disseminate that information. It's publicly available online, but we can send a link around so that you can see where that is.
Chelsea, I saw a question in the chat about the Siren Act grants going are they just going to government agencies? And again, if you look at that list, you'll see that there are some nonprofits in there. And I know that I would suggest to you that if you're a private provider and you're under contract with a county or some kind of other municipal agency or municipal authority, that you go to them in a partnership and have them apply for those funds for you. There were a lot of variety of awardees once you see the list of who those went out to. And frankly, the first round of those that went out last year, I was quite surprised at the number of collaboration groups that received that money.
Thanks, Bruce. Are there any other questions about the requests to Congress? We have a couple of questions about EMS apprenticeship and funding, and we can provide more information, but the short answer, and Matt, jump in here if you'd like to, but the short answer is there is a wide variety of healthcare training, apprenticeship, internship programs, and EMS just isn't eligible for them. Matt, if you want to add something to it, that's the underlying issue.
Yeah, real quick, you see it in healthcare, you see it in public safety, where people will come into an organization as a paid internship, as an example, to learn, to get trained, to do workforce development in general. And although those are pretty prolific, certainly in the healthcare space now, because of the $1.5 billion, we're not available to do it. So we're not eligible for it. So just make it available and then develop the mechanism for agencies to be able to apply to attract people into the workforce, to train them, to help cover a portion of their salary and wages while they're going through training, those types of programs. Those are the things that we need to get people into EMS. If we can pay them while they go to training, pay for their training, and then figure out how to keep them, that's what's going to help us long term. And those are the things that we really need to advocate for.
Thanks, Matt.
And Matt, I'd add on to that I think, conceptually, as we work through this, what is an EMS apprenticeship program? is that taking somebody from EMR all the way to, say, community paramedic? And obviously, most of the providers on this call here know that can be a long road, and it can also be financially challenging. As Matt mentioned, money for living expenses during the education, books, uniforms, all the other ancillary costs that go on to the top of tuition. Those are things that we would look to see if we could get funded. And would it be taking somebody from EMR to EMT, and then taking somebody from EMT? A lot of EMTs are not fully operational in their states. For example, do they have IV modules? Do they have the blind airway modules? Do they have additional, say, pharmacology issues that they're being empowered to utilize? So you could modularize those things as they work their way to their paramedic level, and then of course onto a variety of different specialty certifications, whether it's critical care paramedic or community paramedic or flight paramedic or any of the other ones that are offered as kind of post paramedic specialty subspecialties.
Thanks, Bruce. There were a couple of questions about why EMS is excluded from certain funding definitions and sources. And I would just say it's not so much a matter of they are specifically excluded. They just aren't. People assume they are included and they aren't. It's a designation, and Bruce, fill in here if you'd like, but it's really a matter of state by state. If you are designated an essential service, if you're designated, a certain kind of provider, but it's not a matter of they're specifically excluded. They just don't meet the criteria for whatever reason, depending on the state.
I think it goes back to Evan's comments about the EMS counts bill. We don't, when you go to the legislatures, they don't know how many paramedics and EMTs are out there. And, it's kind of hard to say that we have a problem when there's not an actual measurement of where those people are at. And granted, we have some great statistics from National Registry and some of the state EMS offices, but my guess is that as you go around to ask your congressional representatives to support the EMS counts bill, and you start out with the question of, okay, do you know how many paramedics and EMTs are serving in your congressional district or in your state if you're a senator? And I'm sure you'll get the answer of no. And then the follow-up question would be, well, would you know who to call to get that information that are actually active out in the back of an ambulance? And my guess is some of them probably don't even recognize there's a state EMS office in many of the states.
Thanks, Bruce. Matt, we've had a couple of folks ask if you would please repeat the statistics from NREMT. How many are entering EMS? I think it was something along the lines of how many are coming in, how many are staying in, how many are getting out.
So the turnover survey was done by the American Ambulance Association, and that showed a 20 to 30% annual turnover rate in EMS professionals. So that's the first one, 20, 30% turnover rate annually. So annually, that's the data from the National Registry is that for paramedics and EMTs receiving national certification between 2019, BC, before coronavirus, and 2020, when it was just the beginning of coronavirus, the number of newly certified EMS practitioners dropped by 21%. And we'll send a little chart that we have so that if Chelsea and the team want to, at least for visual for the attendees, not for the members of Congress, you can see what that graph looks like, what that chart looks like. It's pretty pronounced. We're waiting for the 2021 data. Hopefully that'll be out shortly. But I think any of us that are in the profession knows that the numbers probably aren't looking much better. And even the ones that are getting certified, are they actually working in EMS? Or are they working in other locations? And we've seen some of the data on that. But hopefully that helps answer the question. I'll get the information over to Chelsea so we can see the chart.
Great. Thanks, Matt. A lot of great questions. If you have others that have not been answered, feel free to send us an email. You can get us at emsonthehill@wswdc.com, or you can email NAEMT directly, advocacy@naemt.org, and we'll get to those other questions. I want to make sure and be mindful of the time so we can get to the rest of the program, but a lot of great questions. Really appreciate everybody's participation. And we also will disseminate a recording of this event a little bit later so you can watch. So Bruce, back to you.
Okay, great. Now, Chelsea, we'll review the logistical issues that are involved with this year's Hill Day visits. Take it away, Chelsea.
Thanks. Put on my other hat here. So really appreciate this opportunity, and it's great to see how many people are participating here and are doing the things that that are important to the industry. I think we want to applaud that, and we have a lot of participants, and whether you're doing this for the first time or for the 10th time, thank you. Your participation is so important, and we hope that you see that. I want to make sure before we get into the details that you understand there is a level of tenseness and polarization on Capitol Hill that is very significant. And your Hill Days are occurring in the midst of all of that. Congress is arguing over lots of different issues, and tensions are running really high. It's really important for you to keep that in mind as context when you're participating in these meetings. And just remember, you're going to be most effective if you stick to the issues that we're talking about, and make sure that those congressional offices understand the challenges that face EMS and how they affect you, how they affect the community, how they affect the state, and make sure that you have make that direct connection. We'll talk more on that in a minute in kind of the do's and don'ts, but I just wanted to set that stage up front. So there are a few things to be aware of to make sure that you're all ready and on the same page with the rest of your group. You will participate in a state briefing, and those are occurring tomorrow on Thursday and on Friday. So you should have received an invitation. If you didn't, again, let us know and we'll send that out. But here's the schedule for those state briefings. So note all the times listed are Eastern time, so please make sure to make that adjustment. Some of you may have registered with an email address or something that you don't often use, and so just make sure to check there and check your spam to make sure you're not missing any of this important information. So the state briefing is really an opportunity for all of the EMS on the Hill participants from your state to gather together and coordinate ahead of your virtual meetings. I know we have a lot of first-time participants this year, and so we want to make sure that they have an opportunity to meet the others in the group. But this is a chance to walk through what you need to know ahead of your meetings and what to expect during the meetings, and talk through those congressional requests that we just talked about. Each state's been assigned a meeting facilitator just to make sure everything goes smoothly. So in terms of our meeting targets, we reached out to both senators from every state that's representative, as well as the member of Congress who represents each person who is part of your group. So everyone in your state will attend the Senate meetings together. And for the House meetings, each participant should attend the meeting with their member of Congress as well. I know in some states, you all prefer to go to the meetings together for the whole state, and that's perfectly fine. You'll get invitations for all the meetings, but just know the expectation at a minimum is that you'll attend the Senate meeting and that you will attend your member of Congress. So you'll receive calendar invitations for all those meetings for your state, and they'll also be listed on the itinerary that you'll get. So again, during your state briefing, just discuss what your plan is. Are you going to attend all of them? Are you going to attend some of them? Just so everybody's on the same page, and so we don't have a meeting that no one shows up to, because that is a really bad look for us if we schedule a meeting and nobody shows up. So our event spans from Monday the 4th through Friday the 8th, but all of your meetings will occur on one day. So you can see here the assigned dates for each state. And I know we've had a number of later registrants. And so if you have questions about any of this, please feel free to reach out. But again, many of you received calendar invitations for the meetings that have been scheduled so far, and that's going to continue over the next couple of days as we get meetings locked in. There are a number of offices who, just as a matter of practice, will not confirm meetings more than a week in advance. And so there will be some last minute changes that happen, and we'll keep you posted on that. One thing I want to note in particular is you will get in the calendar invitation, you will get it will include the links to the request to Congress. It will include the Zoom link for the meeting. In a few rare cases, the office prefers to use something different, Microsoft Teams, a phone call, something like that. And if that's the case, that's included as well. But I just want to note that we have added in the body of the message, the time in Eastern time. We had a couple of issues last year where your calendars, for whatever reason, just didn't adjust the time zone. So we had folks who were in California who had the time not adjust from Eastern. So just to make extra double sure that everybody gets the correct time, we've added that in there. And again, you will also get an itinerary where all the times will be listed again in Eastern time. A couple of other notes: if your calendar says that it's a member meeting, that means that the office has indicated that either the senator or the congressman themselves is expected to stop by for at least part of the time. And keep in mind, that's always subject to change. We found that in kind of the Zoom era, it is easier for members of Congress to kind of to stop by these meetings and stick their head in, but it's really a matter of what the schedule's like that day. So don't be disappointed if you're just meeting with staff. I would also mention that your dress code for these meetings should be business casual, or uniform is great. But don't be surprised if staffers are a little bit more casually dressed. There are still a number of staffers who are working from home. And if they're not in the office, they may be in a little bit more casual attire. So again, earlier this week, you received an email from NAEMT that included links to the request to Congress, talking points, background, information, and some other tools, including a do's and don'ts list. I put that link in the chat. So if you did not receive the email, please check out that link. Everything is posted online on NAEMT's website. I want to go through a couple of do's and don'ts. And again, if you have questions about any of these logistics, then please use the Q&A box. Just enter your question there. We'll get to as many as we can. Some just good practice before the meeting. Make sure you have the Zoom link. Make sure your internet connection is working. Make sure that your device is either plugged in or it's charged. Make sure you're in a quiet place with a neutral background if that's possible. And confirm that you know who's going to be taking the lead in this particular meeting, who's talking about what, and what your role is, just so everybody's on the same page. If you can, try to join the meeting a few minutes early so it can start on time. We've set up the meetings as no host meetings. So essentially, you don't have to wait for someone to get the meeting started. As soon as you click on the link, you'll join the meeting. And during the meeting, definitely introduce yourself and talk about your work, how it affects the community. And if it's possible, turn on your camera and keep it on the whole time. It shows that you're engaged, that this is important, and it gives you a better chance to kind of connect with the staff. Make sure you're muted when you're not speaking, just to avoid background noise and confusion, and be respectful of the others. I think we all have so much we want to share and help them understand, but if you have something that you want to add, wait for a natural pause, or ask, your meeting facilitator to give you a moment. But whatever you do, don't talk over the member of Congress, don't talk over the staff. Just try to be mindful of cutting them off. And I would also just underscore, stick to the script. The priorities that we talked about with the request to Congress were carefully chosen for very specific reasons, as our presenters discussed. And I think the other item that we didn't discuss specifically is for House members to join the EMS, the Congressional EMS Caucus. So all of this information will be in your talking points and in the materials that you'll get to leave behind. But it's really important. Don't raise other issues. Don't get off topic. Just stick to the things that we've all agreed on. And of course, definitely thank the member of Congress and their staff for their time. A few don'ts in the don't category. Don't be disappointed if you're meeting with a staffer and not the member of Congress or the senator. The staff has the member's ear. They are the ones who make do all the legwork to help the congressman or the senator make decisions. So just know that they're really influential. Also, don't assume that they know anything about the legislation, either if you refer to it by name or by number. It's perfectly fine to say, do you know anything about, are you familiar with the Ems Counts Act? And then take your cues accordingly. If they say, oh no, I've never heard of that, then great, give them a little bit more background. Another don't is look at other devices, check your email, answer the phone, respond to texts, anything like that, that will be distracting during the meeting. If you can put everything on silent, put it aside, that's the best way to do it. And this one might seem obvious, but all of these are on the list for a reason. It's because we've seen it before. Don't make things up. If you don't know the answer, that's okay. It's perfectly fine to say, I'm not sure, but let me get back to you. And then someone on our team can help you come up with the response. And, if it's statistics, if it's whatever the material is, if you don't have an answer, that's perfectly fine. And the last really serious don't, again, going back to this very, very difficult environment, don't talk about the hot button issues of the day. That includes, your views on the president, whether they're good or bad, your views on the conflict in Ukraine, or what's happening with inflation, or the January 6th committee. Whatever the issue is, if it is not related directly to EMS, it is really difficult to recapture their attention. It can be a real turnoff for staff. Whether they share your opinion or not, it really has a detrimental effect to how effective you are. So talking about issues like that just makes them less receptive to our message. So avoid it. Don't put them in a position where they feel, uncomfortable and have to deal with those issues that they're just not equipped to handle. These are healthcare staffers by and large, and they want to talk about the issues that are affecting EMS. Just a couple of other tips. If you are presenting one of the requests and you're running late, let your meeting facilitator know as soon as possible, so that there's no problems with having somebody cover. It's not appropriate to record audio or video of the meeting, so don't do it and don't ask. However, a lot of offices don't mind if you take a screenshot or some kind of photo. Just ask. Make sure that you ask, would you mind if we took a photo? If they say yes, great. If not, then don't do it. If your Zoom link for some reason isn't working, or you don't have the bandwidth, there is a dial-in option on every meeting. And if you have to dial in instead of joining by Zoom, that's perfectly fine too. Just make sure that you join and make it on time. With that, I'm happy to answer any questions that folks have. I see there's a couple here in the chat. So let me see if these are, excuse me as I scroll. So one of the questions is, will the member of Congress already have copies of our ask? And the answer is yes. We are including those in the meeting invitations that go out to congressional staff. So there are going to be links in those emails. Some of the staff will have reviewed the material, some of them won't, but they will have been given the material ahead of time, and we will follow up with that material. Great question. The EMS caucus letter. So there is that will be included in your packets, in your information, is a copy of a letter. They call it a Dear Colleague letter, but it's basically from the two co-chairs of the caucus, Congresswoman Dingell from Michigan and Congressman Richard Hudson from North Carolina, announcing the relaunch of the caucus and asking members to join. So that letter will have the contact information for the staff that can help them get signed up. And so all that information will be available there. Another question, can we have people join the meetings who have not registered? We ask that you don't do that. We have to account to those offices for who will be attending and what the original request was. So we would ask, if you are not registered and you are not a part of that delegation, please don't attend those meetings. Let me just see if there's a couple of other questions here. I think that's it. I'm just looking through. I think that's it. If there are any other questions, feel free to flag them. Another question was, are you going to get a copy of this briefing? Yes, we will send around a recording so that you can review this information again. And I think that is it. So I'll turn the time back over to you, Bruce, if you're ready.
Yep. Thank you, Chelsea. Again, I think going through the do's and don'ts, again, really important. These congressional staffers actually prep for your visit. So they get the printed material from Winning Strategies before they get there. So again, if you introduce something that's off script, they're going to kind of give you a look. And then potentially, we've had situations where, again, people get off script and the staffers just dismiss themselves and move on to their next meeting and cut your time short. And you don't want to shorten your visit at all, as they've blocked this time out. So again, very critical on the do's and don'ts. I want to move on now to our next part of the presentation, which is NAMT established the NAMT EMS Political Action Committee in 2018. It's designed to help us support candidates who are friends of the EMS profession and the patients we serve. And I'd like to introduce Chris Way, our chair of the EMS PAC committee, to say a few words.
Bruce, thank you so much and welcome everybody today. We just very much appreciate you all being here, and we're looking forward to this event. Look forward to being together again in person, but we have a great opportunity in front of us. And because of that, EMS on the Hill Day is an essential component of what we do in our industry to highlight and spotlight EMS and the important job that our industry and our people carry out. National EMS associations, state EMS associations, local EMS agencies, and individuals contribute time, energy, and financial resources to advance our agenda on a regular basis. Financial resources are an essential component in what we do in advancing the cause of EMS. It really does make an effective advocacy if we are able to pay to play, so to speak. Through political action committees or PACs, members of the association can contribute, can support EMS financially, and then we in turn through the PACs can support candidates that support EMS. And there have been some great examples of candidates on both sides of the aisle at the federal level who have supported EMS and done great things for our industry. PACs are a reality of the American political landscape, and EMS, we need to be as involved as other people. In addition to our PAC and NAMT's PAC, the AAA, the Congressional Fire Service Institute, the National Association of EMS Physicians all have PACs that they have to help elect EMS-friendly legislatures to Congress. We would encourage you to, no matter which PAC you or no matter where your membership lies. Of course, we'd love it if you'd contribute to the NAMT PAC, and for members, you can do that very easily. But no matter what we need, what we do, and what we ask you to do is consider a contribution to your PAC to bolster our advocacy efforts on behalf of EMS. Because what we're doing is important, and the fact that we have a seat at the table is incredibly important. So. Bruce, with that, I'll turn it back over to you, and thank you for the opportunity to speak just for a couple of minutes on the PAC and the importance of what we're doing in the PAC.
All right. Well, thank you, Chris. It's now my great pleasure to introduce Troy Tuke, the chair of the NAMT Advocacy Committee, to announce the 2022 EMS Advocate of the Year Award recipients.
Thanks, Bruce. Thanks for everybody being on the call. Thanks to our sponsors who have generously sponsored these awards this year. That includes Stryker, Mersbron, Crestline, and MedX. These awards are presented annually to recognize EMS professionals for their efforts to advance the EMS profession through advocacy in their particular state and at the national level. This year, we have three very worthy recipients. First is David Blevins from Knoxville, Tennessee. David is the director of EMS education at Rowan State Community College in Harriman, Tennessee. He has hosted city and county leaders to help expand their knowledge of EMS through discussions and simulated cardiac arrest scenarios. David participates in events that nurture conversations and relationships with local, state, and federal legislators. He also visits the offices of senators and representatives to advise them on EMS issues. David believes advocacy is imperative to enhancing the future of EMS, and the more EMS professionals have access to advocacy opportunities, the better the profession will be. He has inspired college faculty and students to learn more about EMS advocacy and the legislative process. David also participated in last year's Hill Day and served as a leader of 2 state delegate groups. He has also participated in many advocacy events in the state of Tennessee. His profound desire to make EMS the best profession in healthcare comes through in his podcast messages, which he has delivered, and other conversations that he has held. So congratulations to David for this great award this year.
Hello, my name is David Blevins, and I'm the Director of EMS Education at Rome State Community College and the co-founder and host of the EMS Handoff podcast. I'm honored to be notified that I am one of the 2022 EMS Advocates of the Year from the National Association of EMTs. It is with great honor to represent our practitioners in the field in talking with local, state, and federal legislators about the profession to continue to build the best profession we can possibly have. For all of my partners out there that are joining in the EMS Day on the Hill, thank you for everything you do, and together we'll continue to make this profession even better than it was yesterday. I'm humbled and honored to receive this honor, and I look forward to continuing to advocate for this profession over the coming years. Have a blessed day.
Our next recipient is Paul Roman of Shrewsbury, New Jersey. Paul is an EMT with the New Jersey Department of Health Office of EMS and Executive Director of the New Jersey EMT Registry. He has been a leader in educating government officials at all levels through letters, emails, and participation in advocacy groups hosted by NEMT and other national organizations. As a prominent advocate at the state level, Paul is credited with the ability of translating key issues effectively to all groups. In several cases, Paul has become the go-to person for information on EMS and public health subjects. To communicate to the leaders in EMS and public health communities, he established several Google groups and posted a range of pending legislation, regulation, articles of opinion, current research, and more to ensure that the group's members were aware of the potential impact on EMS. Paul's successes are numerous and have resulted in a change or passage of legislation and regulations. He has been recognized by the New Jersey legislature for his work in national EMS development and designated as a fellow by the American National Standards Institute International. Congratulations, Paul.
Please express my sincere thanks to President Evans and the rest of the selection group for choosing me as a recipient of this year's EMS Advocate of the Year award. I've served my community as an EMS volunteer for 54 years and as a public health volunteer for 43. Since the beginning of this journey, I found myself being selected as an EMT instructor and sitting on various advisory boards for both the federal government, the state government of New Jersey, and various professional organizations, including the ASTM International Committee F30 on EMS, and serving as the National Registry of EMTs BLS exam representative in New Jersey for over 31 years. In both the EMS and public health fields, I've been proud to be able to use my various positions to advocate for those legislative or organizational initiatives designed to better the opportunities and capabilities for those working in these fields. I am proud to be able to point to successes in both professions and plan to continue my efforts. The work of NAEMT is exceptional for its successes in representing and advocating for those of us in grassroots service to our communities. Again, thank you for this high honor and recognition.
Our final recipient is Brian Webb of Anchorage, Alaska. Brian is the state EMS training coordinator for the state of Alaska Office of EMS. State Senator Josh Rebick is one of his nominators with whom he has worked closely to draft legislation favorable to EMS, which has passed both houses unanimously. Brian was also instrumental in educating legislatures on the medical issues faced by emergency responders in Alaska, such as cancer and firefighters. He educated government leaders on the importance of unifying EMS under one regulatory authority and is an advocate of mobile integrated healthcare and community paramedicine to better serve the needs of rural Alaska. Brian has spent numerous hours coordinating discussions between new entities and diverse delivery models and providing advice on what was required for EMS legislation to progress. His models and providing advice on what was required for EMS. His involvement has helped gain legislative traction when there was none previously. Making personal sacrifices, Brian has demonstrated selfless service to a worthy mission, said Senator Revick.
Greetings, everyone from Alaska. I'm Brian Webb, a 44-year paramedic, educator, and military retiree. I'm so very honored to be selected as a recipient for this award, but please understand it's also being shared with the other 655 paramedics in Alaska. Alaska Senate Bill 21 was a culmination of over 20 years worth of work put forth by the paramedics in Alaska to try to bring EMS under one set of regulations. And SB 21 became law in June of 2021. It was historic for Alaska, and it ended over 50 years of antiquated and highly restrictive EMS regulations governing paramedics. Lastly, we now engage in primary care activities, bringing community paramedicine to our very rural and medically underserved state. We couldn't do that without SB 21 passing. So again, thank you for the award. Be safe, and above all, be well.
Congratulations, David, Paul, and Brian. Thank you very, very much for your great service as advocates for our profession. I would now like to introduce Susan Bailey, NAEMT President-elect, to announce the EMS Legislator of the Year Award recipients.
Thank you, Troy. And now we are honored to recognize two outstanding federal legislators as our EMS Legislators of the Year for their championship of sponsoring key EMS legislation. Senator Bob Casey and Representative Susan Wild from Pennsylvania are receiving this award for their leadership in introducing the Ems Counts Act of 2021 in both the U.S. House and Senate. Both Senator Casey and Representative Wild have worked very hard to support our profession. The legislation will improve the ability of our states and communities to effectively utilize their EMS workforce to care for the sick and injured and respond to major disasters and public health crises. Thank you, Senator Casey and Representative Wild, for serving as our EMS champions in the Senate and the House.
Hello, Senator Bob Casey here. I just wanted to start by thanking the National Association of Emergency Medical Technicians and all of your members for giving me this opportunity to speak to you, but also to thank you as well for the honor of receiving your award, the Legislator of the Year Award. I wanted to start as well by taking a moment to recognize the critical work that all of you do each and every day as emergency medical technicians and paramedics. You've been on the front lines of health in America long before the pandemic, and I know your work will continue long after this pandemic is behind us. I'm working on legislation to help communities better prepare for disasters and address workforce shortages by ensuring that they have an accurate, up-to-date headcount of cross-trained first responders. Since current rules don't appropriately recognize cross-trained firefighters, we don't even know the true size of the EMS community. The legislation, the Ems Counts Act, would direct the Department of Labor to change the designation of firefighter to appropriately reflect the range of skills and training found at local EMS agencies. This bill ensures that the federal government will collect accurate, comprehensive data on quality and training. So thanks for your work in helping us pass this bill, and thanks for the great work that you do each and every day for America. Of course, I'm grateful for the award, and I want you to know we'll continue to work together and keep working in the Senate to pass the Ems Counts Act. Thank you.
On behalf of everyone in EMS, thank you to Senator Casey and Representative Wild. Before we close the briefing, I wanted talk about two things. First, I want to put a PR request in to everybody that's on the call here. If you have enjoyed EMS Day on the Hill in the past, and this is your thing, and maybe potentially someday you want to be on the other side of the chair, taking a briefing from EMS providers. We are offering NEMT in conjunction with Pinnacle's EMS conference in Naples, Florida this year, is offering an EMS political academy. And that's not just how to support candidates, but how to run and be a candidate. So look for future announcements from NEMT and the folks at Fitch and Associates and Pinnacle to conduct that. But again, before we close, we want to make sure that we remind all of the attendees to please attend your state delegation. It's really important that you organize on who's going to pitch which of the bills. Each of you should have received a calendar invitation via Zoom link for your state's meeting. If you need us to resend that, please send in your contact information to emsonthehill@wswdc.com. Again, that's emsonthehill@wswdc.com. We wish everybody successful meetings with their congressional leaders and their staff. Good luck to everybody.